Good morning. Thank you for joining us. This is the California Elder and Disability Justice Coordinating Council meeting, or EDJCC. And we're just going to mention, we're just going to wait a couple of moments for our attendees to log on. Also, our panelists and guests to get settled. Again, if you've yet to change your name from EDJCC panelist, please do so now so we know who's joined us. Thank you very much. Good morning. This is the Elder and Disability Justice Coordinating Council. Today is June 18th. This meeting starts at 10 a.m. and goes to approximately 1 p.m. Next slide. Good morning. I am Carol DeAndres. I am the manager of the Master Plan for Aging, or MPA, stakeholder engagement here at the California Department of Aging, or CDA. And we welcome you to the EDJCC meeting. This is our second meeting for 2025, and we welcome you to this virtual space. I'm going to go over a few meeting logistics. As you can see, we have American Sign Language. Rex and Bailey are our signers, and we appreciate their being with us today. You also have live captioning available to you via the Zoom webinar functions. If you go under the, on your toolbar, there is CC available. Please click on that to enable the closed captioning for you. Meeting slides, transcript, and recording will be available on the California Health and Human Services Agency, or CalHHS, Master Plan for Aging webpage, the EDJCC webpage. And again, council members, guests, panelists, please, if you've yet to do so, please update your name display by clicking in the upper right corner and hitting rename to your name so we know who's joined us today. Next slide. The chat function is enabled for council members, Department of Aging staff, other guests and panelists to share out meeting-related information to our attendees. The public is able to view that in the chat. The chat and the question and answer feature are not enabled for comments or questions from public attendees, but we do have a public comment period. So we ask that you hold those comments until that time period, and we will get to you at that time. And of course, at any time, you can email your written comments to us at engage, ENGAGE, at aging.ca.gov. Next slide. Again, closed captioning is available. We have ASL. And next slide. Logistics for our public comment period. Attendees joining by phone, you have the ability to press *9. That will indicate to us to unmute your line. Attendees joining by the webinar, the Zoom webinar functions, you have a raised hand icon. Mine is at the bottom of my screen. Click on that, and that will indicate you have a comment. Public commenters will have 2 minutes so that we can make sure we have time for everybody's comment. And again, at any time, you can send your written comments to our Engage email box at engage, ENGAGE, at aging.ca.gov. And now I would like to turn it over to our Elder Justice Specialist here at the Department of Aging. Good morning, Ranjana.
Good morning, Carol. Thank you. My name is Ranjana Maharaj, and I have the privilege of serving as the Elder Justice Specialist for the California Department of Aging. It's truly an honor to be here with all of you today as we strengthen our shared efforts to promote elder justice for older adults and adults with disabilities across our state. So before we delve into our agenda items, I'd like to take a moment to revisit our council's purpose and equity guiding principles. Thank you, Kelly. We recognize that past, current interventions and services to prevent mistreatment have had negative consequences for some victims, families, and communities as a result of systemic discrimination and biases. To counter these negative impacts and biases, thank you. To counter these negative impacts and to ensure equity and inclusion moving forward, we're committed to letting the following principles guide all aspects of our work in planning, coordination, and program development. Next slide, please. Equity guiding principles. Number 1, we recognize that all adults deserve to live free from abuse, neglect, and exploitation. Number 2, we acknowledge that the existence of systemic racism, discrimination, and negative impacts, and in order to combat its impacts, we must center equity at all stages of our council's work. 3, centering around equity does not just mean creating equitable solutions for all adults, older adults, and adults living with disabilities, but also recognizing that implicit bias exists within all of us. We're committed as a group to acknowledge and explore biases while doing the work of this council. Next slide, please. 4, we acknowledge that while older adults and adults living with disabilities have many overlapping interests, they are distinct communities, and any policies that are observed or recommended by this council should examine impacts to each community. 5, we recognize the importance of hearing directly from older adults and adults living with disabilities. Their lived experiences should always be centered as we move forward with the work of this council. If we could just pause here for a second, Callie, I just want to mention that our council serves as a platform for collaboration, innovation, and exchange of information. And we're here to amplify these voices of older adults and adults living with disabilities, identifying systemic gaps, challenges, and the thoughtful recommendations that we make to help protect their rights. So with this purpose in mind, let us proceed with the next slide. Thank you, Kelly. On the next 3 slides, you'll see our EDJCC members. I wanted to take a moment to sincerely thank each and every member who contributes to the EDJCC Council, as well as subcommittee participants. Your commitment, thoughtful engagement, and active involvement in discussions and subcommittee work reflect the spirit of true collaboration. And I want to thank you for advancing elder justice across our community, and it's deeply appreciated, and it continues to inspire all of us and drive our shared missions. So today we have a packed agenda. We began with meeting logistics, followed by a quick overview of the council's purpose, the equity guiding principles, and a shout out to our EDJCC members and participants. Next, we'll have opening remarks from our EDJCC State Co-Chair, Susan DeMorris, and EDJCC Stakeholder Co-Chair, Bertha Hayden. After that, we'll shift our focus to World Elder Abuse Awareness Month. We have a panel for scams and fraud that impact older adults, and our speakers include our very own EDJCC member, Scott Perello, and Tiffany Zhang from AARP. At 10:30, we'll move into our agency spotlights with Megan Anderson from Department of DOJ and the Division of Medical Fraud and Elder Abuse. And then we will then turn it over to Eden Rosales, our interim state long-term care ombudsman, to provide an overview of the annual report. We'll take a quick 15-minute break at 11:15, returning at 11:30 for the LGBTQIA plus older adult study findings presented by Ross Lalia and Dr. Sullivan. At 11:45, we'll get an update of the 2023 Public Guardian Survey from Regina Wright. And at 12 p.m., we'll have an update from our EDJCC Adult Protective Services Subcommittee Chair, Akili Saron. At 12:15, we'll open the Florida EDJCC member discussion and pressing issues led by our EDJCC Legal Services Chair, Vivian Mabaku. And at 12:35, we'll move to public comment, and then wrapping it up with closing remarks and next step from both our EDJCC state stakeholder co-chair Susan DeMorris and Bertha Hayden, and we'll wrap up at 1 p.m. Next slide, please. So without further ado, I'd like to turn it over to Director Susan DeMorris, our EDJCC State Co-Chair, and Bertha Hayden, our Stakeholder Co-Chair, to offer their opening remarks and to help us kick off the meeting.
Thank you so much, Ranjana. Thank you very much, Ranjana and Carol, for opening the meeting and leading us off. And thank you so much for displaying the principles that ground us and center us in our meeting. As we've said at each meeting, these are unprecedented times, and that is certainly the case today, wherever you find yourself joining in California. We're concerned about older adults, people with disabilities, and family caregivers. And this meeting today brings hope to me, hearing the lineup of the experts and the work in progress that's happening around our state and communities across California, regionally, and our statewide work together as a coordinating council. So we've been looking forward to today's meeting, to see all of you, to be with all of you, to join together in common cause for the very important work that's ahead for all of us. And I'm just thrilled to be joined by our stakeholder co-chair, Bertha Hayden, as well as our two other work group leads, Vivian and Achilles. You've just been instrumental working behind the scenes. I cannot thank you enough for the hours and advice and counsel that you provide to the Department of Aging and the suggestions that you make reflected in today's agenda, which is very robust. I'm really looking forward to hearing from everyone joining us today, starting with you, Bertha.
Thank you, Director DeMorris. And I also want to echo and welcome our EDJCC members, partners, and members of the public that are joining today. With so many competing priorities, we sincerely appreciate you taking the time to join this meeting and engage with us. Thank you for being part of the important work, and your presence helps make a real difference. Today's meeting holds a special significance as we gather in recognition of World Elder Abuse Awareness Day, which takes place on June 15th each year. This WEAD is always a global call to action, such as our meetings, and gives us an opportunity to elevate the rights, dignity, and safety for older adults and people with disabilities. It's also Dementia Awareness Month, which again allows us to look at the critical issues and recognize how cognitive impairments intersect with elder and disability justice, and individuals living with dementia, how they face an increased risk of elder abuse, neglect, and exploitation, often without the ability to advocate for themselves. Raising awareness within our systems means promoting trauma, person-centered, informed care, strengthening protections, and ensuring that our legal and social services are equipped to respond with compassion and equity. We also have the privilege of celebrating Pride Awareness Month, and we honor the resilience, diversity, and contributions of the LGBTQIA+ older adult community. We recognize the unique barriers they face in accessing inclusive services, including legal supports, healthcare, housing, and through strong partnerships, we remain committed to advancing equity and ensuring that all older adults can age with dignity, pride, and justice. As EDJCC members, we all have an opportunity to share emerging issues later on in the agenda, and we encourage you to take that time to share what you're seeing on the ground, and as it will give us an opportunity to further elevate it. And it also reminds us, again, during these times with competing priorities, that our work together gives us the opportunity to come to collectively to collaborate to address and prevent abuse, neglect, and the systemic exploitation across. I encourage you all to stay engaged throughout the meeting, ask questions, and help us move this work forward. With that, I'd like to transition over to my colleague Vivian, who will share, who would like to share about a particular EDJCC member. Vivian?
Thanks, Berta. And I'm really glad to see everyone on the meeting today. I wanted to take a little time just to give a special shout out to our EDJCC member, Lisa Coleman, as she prepares to transition from her role and she'll be stepping down from the EDJCC. Lisa has been an incredible advocate and valued member of the EDJCC, always bringing deep knowledge and compassion and a strong voice for older Californians. Her insights have shaped our discussions and helped move this work forward in very meaningful ways. Lisa, we're truly grateful for your leadership and partnership, and you will be greatly missed, but we wish you all the best in this next chapter.
Thank you, Vivian. And with that, we're going to transition to our first presentation. I'd like to welcome our speakers for the first presentation, Scott Perello. Scott, over to you.
Thank you very much, and good morning. Good morning, everyone. My name is Scott Perello. I'm a deputy district attorney, and I'm the head of elder abuse prosecutions for the San Diego County District Attorney's Office, and very proud to work for my boss, Summer Steffen, who's our elected district attorney, who is just a warrior for victim justice, especially with elders and vulnerable and dependent disabled adults. So it's an honor to be part of, on behalf of her, to be part of this team. Because it's World Elder Abuse Awareness Month, we thought that we really wanted to spotlight elder fraud and elder scams. There's no place, in my opinion, where we could have a greater impact than to raise awareness and continue to push this giant boulder up the mountain. You see the seal there of the San Diego Elder Justice Task Force, which I'm so proud to have been part of the team that started that, starting in 2018 or so. And we are now a fully functioning task force in San Diego, working with the FBI, our local law enforcement agencies, Adult Protective Services, and our local fusion center. And I'm going to talk a little bit about what we're doing. But first, I wanted to use my time to educate everyone into what the most common scams are right now, because we really need to be spreading the word. Sadly, despite even our best efforts, the best thing that we could do still in this fight is education, outreach, and prevention. We are having lots of successes, but it's in a very small fraction of the cases. And so really we need to keep the money in the pockets, in the bank accounts of our seniors. So I wanted to let you know the most common scams, and more importantly, how the bad guys are getting our money. The most common scam, the greatest threat to any one of us, including our senior and dependent population, as you leave this presentation today, is still a pop-up ad on your computer. Most of them are posing as Microsoft. We are also seeing lots of PayPal impersonators and Norton antivirus or McAfee. It's just telling someone simply that there's some glitch to their computer and they need to call a phone number in order to get help. When they call the phone number, they think they're talking to one of these technology companies. The victims are convinced to accept remote access software onto their computers, and then the scammers infiltrate them. They quickly see where they do their banking, and ultimately our victims are convinced they're talking to their bank, that they're the victim of some huge sophisticated hack, and that they need to secure their money because the hackers are going to get all their money. That is over 70% of all scam activity is a version of the tech support, which shifts into a bank and government impersonation scam. The largest loss amount that we see here in California and around the country are with investment scams. So you may all get these text messages during the day that just says, "Hi, how are you?" Or, "Hey, do you want to go for a walk?" That is what is horribly titled pig butchering, where it's someone that is trying to approach you as a friend and develop a relationship with you. People respond to those messages. They start texting often for weeks and months. And then this person that you develop a relationship with will convince you that you can make a ton of money by investing in cryptocurrency scams, and you'll end up downloading a platform on your phone or computer where it looks like Charles Schwab or something, where you see your account and you actually see your money. It looks like you're making so much money, and so you invest more and more until you're completely wiped out. Next slide. In addition to those, we still see a ton of grandparent scams where people are convinced that their grandchild has been in a terrible car accident, has hurt somebody, and they need to pay bail money. And then romance scams, sweepstakes scams, very prevalent still. Next slide, please. The important thing that I tell people is it's scary that all the scam activity is happening, but you could still fall for the scam, but you still have the money in your pocket, which is great. So it's more important for us to be spreading the message on how the bad guys are getting our money. Next slide. Once you fall for the scam, the first thing that we see most prevalently is them having people wire significant amounts of money, 50, 70, $100,000. Often it's going across the country to another money mule, someone that might also be a victim that has been told to receive money and then send it elsewhere. So people ask, how come we can't catch these people? When we follow the money, they create multiple layers of money launderers to try to keep the real people culpable for these crimes far away from contacts with our victims. So wire transfers are very important, and they are to the tune of tens of billions of dollars. Next slide. This is what I'm often telling people. We are literally under attack. We have hundreds of couriers that are being dispatched, mostly from the Los Angeles area, all over California. Our task force is intercepting these couriers, but once people, our seniors, are falling victims to these scams, they're being told to withdraw $10,000, $20,000, $30,000 at a time from their bank and either package their cash up, or they're being told to go to a pawn shop or a precious metals dealer and purchase gold bullion. And then once they purchase this cash or gold, they package it up and a courier is being dispatched, or they're even using Uber and Lyft drivers to go to people's houses, pick up these packages, and then deliver them to someone else. Like I said, we are picking people off every day in San Diego. It's a great big part of what our Elder Justice Task Force is focused on. But the same couriers that we're arresting in San Diego, we know that they are also being contacted in Ventura County, up in the Bay Area, all up and down the state, and even out to Arizona, Vegas. So it's really like the southwestern United States. Next slide. Bitcoin ATM machines. These are a huge nemesis for us in this fight. Thankfully, the California legislature passed SB 401 last year, which limited the transactions to $1,000 per day per machine. Prior to that, the picture on the left there is a case of mine that's $15,000 or $18,000 that a victim had put into one machine. So these machines are used for fraud. Luckily, with SB 401, California's taken a huge step in the right direction. However, we are seeing an uptick in the couriers now that the scammers can't get as much money from cryptocurrency machines. But around the country, they are looking to us as a model to replicate this limit. Next slide. Gift cards, we're seeing declining activity, but still lots of activities in gift cards. And so the scammers will tell the victims to go to the big box retail stores and buy thousands of dollars worth of gift cards. Next slide, and I'll wrap up in a minute. So what do you do if you have a victim? We need you to report the case to the FBI's Internet Crime Complaint Center. It's www.ic3.gov. In addition, we want you to report to your local law enforcement. And then if you have anyone that you know that's involved in this type of activity, you must report to Adult Protective Services as well. We recommend a three-pronged approach, and it's the only way, and you have to, for any hope of positive intervention, the earlier you report, the better. Next slide. So as I mentioned, the San Diego Elder Justice Task Force is really the tip of the spear leading this fight. We are the model for the country. The former FBI agent that helped found us was actually in Washington, D.C. yesterday testifying to the Senate Judiciary, and they are hoping to replicate this model around the country. And we hope that that with the partnerships and through this Elder Justice Coalition, that we can push this model out and duplicate it in the rest of California. And now I'm proud to turn this over to Tiffany from AARP.
Thank you so much, Scott. Really appreciate the invitation to be a part of this conversation and just the incredible work the Elder Justice Task Force has led for San Diego County. And thank you, EDJCC, for spotlighting elder fraud for today. So I lead the community education outreach with AARP in San Diego. And just to give a little bit of context around AARP, so we began around 70 years ago when our founder, Dr. Ethel Percy Andrus, discovered one of her former teachers actually living in a chicken coop. And she was appalled. This woman who had worked her whole life teaching next generation couldn't even afford housing. And this moment sparked her mission to ensure that no older American would be forced to live without dignity or security. So when you think about protecting financial security of older adults, that's what the AARP Fraud Watch Network is all about. Think about the hard-earned savings that people have. We want to make sure that they get to use that in their later years. So just wanted to highlight some of the key resources from the Fraud Watch Network and how we're using that to tackle the issue of elder abuse, fraud prevention, etc. So AARP is a wealth of different resources. Just some key ones I wanted to highlight is we do a lot of teletown halls where we have featured guest speakers from major agencies like the FTC, FBI, etc. They talk about key topics. We also have done free community shred events. And then we have 2 series here in California. We have Scam Chat Wednesdays, which this past August, was a collaboration with the CA Department of Financial Protection and Innovation. And then we do like cyber chats, which kind of go more specific in cybersecurity. And these are all online programs that are free and open to public for people just to learn more and be more aware. And then we also do a lot of community fraud presentations, and I'll share more about that later and how we do that through our fraud fighter volunteers. We sort of bring these presentations to different community groups, libraries, senior centers across the state to get that information out there. And so what's really unique, there's a stat that says if people are aware of a specific scam, they're 80% less likely to participate in it, which is why education is so critical in this effort, along with the great coordination that our law enforcement, Deputy District Attorney Scott is leading, etc. So we really see this as going hand in hand in collaboration. So some things that we'll talk about a little bit later is these scam jams that we've been hosting across the state. There's actually one happening right now at the Santa Clara Department of Aging, where they're bringing together different experts and to share the top scams so people can have that awareness of what they might experience so they can stop and pause and verify before maybe getting too far into an issue. Some other key resources I just wanted to highlight that are available nationally are fraud victim support services. So we do have a fraud helpline that is run by volunteers, trained volunteers, who kind of are that warm entry on what do I do? Am I experiencing a scam? You can talk through, hey, I got this letter in the mail. What is this about? And they'll kind of talk you through, is this legitimate or not? Or they'll also help you report it. If you know maybe it's intimidating to call law enforcement or something like that, the Fraud Watch helpline I see is a really good peer-to-peer support where people can help you with reporting. So that's available Monday through Friday, 8 a.m. to 8 p.m. Eastern. And then we also have a lot of support groups because this is a traumatic experience for a lot of people when they experience fraud. So we found that having support groups is really effective just to provide a space to talk about it. How do you rebuild trust out in community? How do you kind of find like some peace in like healing within your own self after you experience a fraud? But the key part I wanted to highlight as we think about World Elder Abuse Awareness is on the next slide, which is our scam jams. So I'm just going to highlight kind of the anatomy of a scam jam from our San Diego Scam Jam tour that we're currently in the middle of right now. Initiative to educate and empower older adults and their families. And so we did this in partnership with the San Diego Elder Justice Task Force, the County of San Diego, Senior Tech Connect, and then other groups. And the whole point was to bring this education to the community, give them skill building tactics, and really tackle this head on so that the tech scams and the pig butchering scams that Scott mentioned, people would already have an awareness of it and hopefully stop themselves before getting caught into one of those scams. So we're doing 12 fraud presentations, 9 cybersecurity classes where they actually do hands-on. How do you use a password manager? How do you even check if the email is legitimate, scrolling over those URLs. And then also community shred events, shredding your documents. And then the key part in specific with World Elder Abuse Awareness Day is we're hosting a Meet the Experts financial abuse kind of program this Friday, just to offer that kind of what is happening behind the scenes. How is Scott, the FBI, Adult Protective Services, et cetera, coordinating to tackle this this large scale issue of fraud? So some of the key messages that is big for the fraud prevention effort is just that fraud is a crime. It's not a mistake. We need to stop blaming the victims in this experience. And scammers are using really complex psychological tactics, fear, urgency, love, to manipulate these victims into acting quickly. So we want to give people the tools to pause and verify in those moments, and really offering unique resources so that they can feel empowered in being able to stop in case of a fraud. And so this model is scalable and replicable. It's just bringing different groups and partners into the space, bringing the timely information, and tackling this fraud challenge in community. Lastly, just wanted to share a little bit more about AARP's sort of larger framework for this work. It's just getting more reporting out there, because we know that victims can feel maybe embarrassed or shameful about sharing this experience. We really want to reduce the shame around this and increase reporting, so that then supports that larger coordination effort with the fusion centers, et cetera, so they can actually try to put together cases to tackle these fraudsters. So as we all know, scams and frauds and elder abuse is an actual crime, and for some reason there tends to be a lot more victim blaming. So we want to kind of change that to be more trauma person informed and change that narrative around how we talk about fraud. So on the next slide, you'll see some of the ways we could try to tackle this in the way that words matter. So instead of, talking to an older adult and saying like, how could you fall for that? Flipping that and say, hey, this wasn't your fault. You experienced a crime. How can we talk about it? How can we get you the resources needed? So it's just changing the narrative around how we talk about fraud and scams, so people can feel more comfortable and safe to share their experiences, and we can increase the reporting and ultimately tackle this issue. So appreciate you listening to all the different resources of the Fraud Watch Network, learning a little bit more about the Scam Jam Tour, highlighting some key resources on the slide, and I think they'll be in the chat as well. But ultimately, if you can spot a scam, you can stop a scam. And it's really important that this is a collaborative effort between these different stakeholders to tackle this issue, because it's only through education, awareness, and the data and reporting and the investigative work that we can really tackle this. So thank you, Scott. Truly, I mean, the Elder Justice Task Force is such a great model, and we hope to see that implemented across the nation. So
Thank you, Tiffany and Scott, for those presentations. I know my subcommittee member, Vivian, sees some questions from members that she will call out. Vivian?
Yeah, thank you, Berta, and thank you to Scott and Tiffany. This was really great. I know we had a question about the scam jams. If any of them are online, Tiffany, I don't know if you wanted to take that.
yeah, of course. So I will note ARP Fraud Watch Network has a wealth of videos, resources, and programming online. The Scam Jam, for example, the one we're hosting Friday, where Scott will be one of the featured panelists, we are going to be posting that on YouTube for people to watch later. And then there are some online presentations as well. I think the best resource would be the arp.org/fraudwatch network to get access to those.
Great, thank you. Um, this has been a really great presentation and really highlights a bunch of different things that we want to touch on. First off, there are some additional resources that have been posted in the chat, and one of them is also a CDA resource on protecting older adults from scams and fraud. So that's something that's California specific. And CDA on their website offers some practical tools to help older adults recognize and report scams and financial abuse. And it's really critical that we continue educating people on these scams, as Scott mentioned, it's clear that these things are quickly evolving as one scam, like the gift card scam was really popular a few years ago, and that's waning, and now we've got other types of scams. So we really have to be pretty nimble, when we're trying to educate people about what the risks are. I think also this presentation really highlights how important it is to fight isolation amongst older adults. We know that isolation is such a huge risk, but it's clear with these scams, an isolated older adult is even more at risk because they might not have someone to reach out to say, what does this mean? Do I really need to, pay attention to this warning from, a government agency, et cetera? So I wanted to ask Scott if you were seeing like a through line of isolation among some of the older adults that you're seeing that are coming with these reports of being scammed.
Thank you for the question, Vivian. It's a great question because I obviously raise so much awareness and talk about isolation as a risk factor for all the different varieties of elder abuse that we see. You'd be surprised. The profile of our victims are often people that have not fallen victim to this assume these are people maybe with Alzheimer's and dementia, and they are isolated. But to the contrary, we often find that our victims are still living very robust lifestyles in their late 60s, early 70s. They are living independently with family engagement, active in their grandchildren's lives, still driving, still working, and and they've been, because of what Tiffany was talking about, is the social engineering the scammers are using. They are terrifying our victims from telling their families they're going through something. So they're being isolated in the moment by the scam itself, but they're not necessarily people that are socially isolated to begin with. Now, I don't want to downplay that because that is the biggest risk factor we have for all the other traditional kinds of elder abuse, but it really shows how sophisticated, in particular, these scams are, and it speaks to the messaging from Tiffany about not victim blaming. The reason why people are falling victim to this is because the scammers are so good at what they do in scaring our victims into action and then convincing them that there's some legal reason why they shouldn't tell anyone in their lives about what's happening.
Great, thank you, Scott, and I will pass it back to Berta.
Thank you again, Scott and Tiffany, for those presentations. I think when we talk about elder abuse and we hear the overwhelming amount of the numbers of the loss that our older adult community is suffering, it can feel very overwhelming. But your presentation helps to center us around action steps, around prevention and intervention. That's clear. When you were going over the types of abuse, it felt like going through our intake line. The stories are just so common, right? And so, the work continues, I think, to let people know what the patterns are, because that's how they can spot it. So thank you again for your work. Now we'd like to transition to our agency spotlight. I'd like to welcome Megan Anderson, Supervising Deputy Attorney General of the Department of Justice, for our next part of our presentation. Thank you, Megan, for making the time today.
Thank you for having me. We can go to the next slide. I am a Supervising Deputy Attorney General for the Office of the Attorney General in the Division of Medi-Cal Fraud and Elder Abuse. A little bit of background about me. I spent 10 years as a local prosecutor in Modesto, California, at the Stanislaus County DA's office. While I was there, I was part of the Elder Abuse Prosecution Unit. And when I decided to make the move over to state service, I was really excited about the opportunity to continue my work in this area and to work at prevention of elder abuse against both the elderly and also our disabled adults at the DOJ. The Division of Medi-Cal Fraud and Elder Abuse is one of 4 divisions within the Office of the Attorney General. And as our name says, we focus in 2 primary areas, one being Medi-Cal fraud and the second being elder abuse, primarily focused on facility abuse. You're looking at our skilled nursing facilities, assisted living facilities, as well as homes where our dependent adults also reside. And I use the terminology dependent adults, and I don't say that to offend anyone, but that is the terminology that is used in the penal code I do prefer disabled adults, but those terms are used interchangeably in my office, so I hope I don't upset anyone with those. Next slide, please. The Department of Justice in the Division of Medi-Cal Fraud and Elder Abuse serves as California's Medicaid Fraud Control Unit. And essentially what a Medicaid Fraud Control Unit is it's an agency, there's one in every state, which has the mission of safeguarding and protecting the funds associated with Medicaid in each state. So we work hand in hand with the Department of Healthcare Services, which administers and manages the Medicaid program in California, which is known as Medi-Cal. What I learned when I came to the Department of Justice, I didn't know too much about how Medicaid works in California or what Medi-Cal really was. But what I learned is that Medi-Cal in California, aka Medicaid, is part of a larger federal program, and it provides health benefits and healthcare services to low-income individuals and families, as well as adults and children with disabilities. Each state has to do one of two things. They have to either certify that they don't have any Medicaid-related fraud in their state, or they have to have a Medicaid fraud control unit to safeguard the Medicaid funding in their state. And of course, no state can certify that they have zero fraud, so every state has a Medicaid fraud control unit. The reason why is because in the 1970s, when the Medicaid program was established, Congress realized pretty quickly, wow, we really need an oversight of this program to prevent it from fraud and abuse. We have a very unique funding structure at the Division of Medi-Cal Fraud and Elder Abuse. Most state agencies are primarily funded by the state of California, but we are 75% funded by the federal government and 25% funded by the state of California. As I mentioned, we work closely with the Department of Healthcare Services, but we also work very closely with other federal partners, including the Office of the Inspector General, the FBI, as well as local agencies in law enforcement, sheriff's offices, police departments, as well as adult protective services, as we work together and jointly to prevent fraud and abuse from occurring in our state. Next slide. These are just some Medi-Cal statistics which demonstrate really the importance of the work that the Division of Medi-Cal Fraud and Elder Abuse is doing, because we have so many Californians who receive some sort of benefit from the Medi-Cal program. As this slide shows, we have over 39 million Californians in the fiscal year of 2023 to 2024, and nearly 15 million of them received some sort of Medi-Cal benefit. We spent close to $152 million in Medi-Cal spending, involving over 13,000 healthcare workers and 400 plus hospital providers. This slide really demonstrates not only the importance of preventing fraud of the Medi-Cal program, but really just the importance of Medi-Cal in general and why it is a program that should be protected, which is the mission, again, of the Division of Medi-Cal Fraud and Elder Abuse. Next slide. We have a presence throughout California, from the far north up in Redding to San Diego at the border. This slide demonstrates the growth that we have undergone, particularly in the last few years. This slide shows that we have a number of different offices throughout Southern California, particularly in the Los Angeles area, because for those of you who are down in the Los Angeles area, you know that there are a ton of skilled nursing facilities down in that area, as well as other Medi-Cal benefit providers. We've opened offices most recently in Redding, and we're trying to build our Bay Area presence with our Dublin office. You may know the Division of Medi-Cal Fraud and Elder Abuse, or DMFEA, by its prior name, which was the Bureau of Medi-Cal Fraud and Elder Abuse. Previously, before September of 2020, we were BMFEA, and we were part of the criminal division at the Office of the Attorney General. But in 2020, we became our own division, in part because we are partially federally funded, but also because we do both criminal and civil work, and we are a unique hybrid office. And so it was important that we not be just under the criminal division, but we be our independent owned division so we can continue our work. Next slide, please. This slide demonstrates really kind of one area of focus that we have, which is the Medi-Cal fraud area. It's important to remember that when we criminally prosecute or civilly prosecute Medi-Cal fraud, we are not focused on beneficiary fraud. We are focused on provider fraud. Those individuals who provide some sort of healthcare service to Medi-Cal beneficiaries, and then in exchange for that service, they receive taxpayer dollars in the form of Medi-Cal billing. Our primary provider fraud is really a fee-for-service or managed healthcare plan fraud. And this is oftentimes schemes in which a person will be a Medi-Cal provider and they will bill Medi-Cal for either services that were not even rendered or services that were unnecessary. So for example, right now, a hot topic is hospice fraud. This is particularly relevant in the Los Angeles area right now, in which hospice providers will sign folks up for hospice. And sometimes the person doesn't even know they've been signed up for hospice, or the person is not in need of hospice, which is really unfortunate because hospice is such an important program that we have and a benefit for people. And unfortunately, some folks abuse it by billing unnecessarily or without any sort of legitimate reason. Another form of fraud that we have is individual whistleblower cases. Those are primarily on our civil side in the form of qui tam cases in which a whistleblower will file a suit to the state alleging that there's been some sort of fraud committed, and then the state can either determine whether or not they want to intervene in this lawsuit. And if they decide that they are going to, they will take up the lawsuit and move forward with it on behalf of the state or federal government. This is an area where we work very, very closely with our federal partners because oftentimes Medi-Cal fraud can go hand in hand with Medicare fraud. And if that is the case, then we will join with our federal partners. Additionally, we have a variety of other violations in the civil area, in the False Claims Act area. This is a little bit out of my wheelhouse because I'm a criminal practitioner, but my understanding and my knowledge from working at DMFEA is that we are recouping millions of dollars in fraud on behalf of the state of California as well as the federal government. And so this is a really important place where we're able to get back those monies that have been taken from the taxpayers in terms of fraud and abuse. Next slide. This slide really is more in my wheelhouse as this is the abuse and neglect area. I head up a team in Northern California and I work closely with our partners in Southern California on what's called the Facilities Enforcement Team. And we focus on abuse and neglect in facilities. We work very closely with the Department of Social Services and the Department of Public Health. We get many, many thousands each year of complaint referrals from those agencies. We look at those referrals and those complaints, and we investigate those that we feel could lead to either criminal or civil prosecutions. We take those complaints, we open investigations, and we move forward with them, particularly, again, focused on long-term healthcare facilities that accept Medi-Cal patients. That allows us to have jurisdiction to investigate them. Many, many skilled nursing facilities in the state of California accept Medi-Cal, and this allows us and gives us jurisdiction to investigate abuse that takes place in those facilities. We also have jurisdiction to investigate abuse in boarding care facilities, also known as assisted living facilities or RCFEs. When we have two or more unrelated adults or disabled adults who receive substantial assistance with the activities of daily living. So this could include toileting, bathing, eating, walking around, whatever the case may be, but that is essentially the parameters that we have in order to accept a case and investigate it. We do also investigate abuse and neglect in non-institutional settings in which you have a Medi-Cal recipient who is receiving some sort of benefit and the abuse is taking place in concurrence with the provision of Medi-Cal services. So an example of this that we have listed here is pediatric dentistry or Medi-Cal transportation services. But a really, really common one is for our victims who are in their own homes and receiving support through the IHSS program. This is the in-home support services program, which provides and allows our elderly individuals to receive help at home. If the beneficiary or the victim is abused by their IHSS provider, we would have jurisdiction to investigate those cases. We handle not just physical abuse, but also sexual abuse, financial abuse, as well as neglect within this environment. Next slide. This is an example of some of the personnel that we have working at DMFEA. We are very unique in the state in that we have in-house special agents who work hand in hand with our prosecutors from the bottom up. So this is an example of a vertical prosecution model in which the agents or the law enforcement folks are working hand in hand with the attorneys at the very earliest stages of the investigations. We also work closely with auditors who help us on our fraud and financial abuse cases. We have data development analysts who look at just the raw billing data associated with Medi-Cal, as well as medical professionals. On my team, we have 3 nurses who are indispensable for helping us understand what can be sometimes the complex medical terminology associated with our complaints. And they are tireless advocates on behalf of our disabled adults and our elderly populations. Next slide. Again, this is some of the expertise that we had. I mentioned our medical expertise on behalf of our nurses. We also have people who have a lot of experience in the area of elder abuse and neglect. One of the really interesting parts on this slide is the SNF staffing ratio analysis. We are really trying to develop our Civil Business and Professions Code 17200 cases. These are unfair competition civil lawsuits that the state can bring on behalf of, or by DMFEA, on behalf of the people of the state of California and the Department of Justice, which challenges the staffing ratios in skilled nursing facilities. As many of us know, if you've ever experienced or been into a nursing home, you know that the most important component is staffing. If you don't have adequate staff, then you're going to have things like pressure sores and falls and medication errors and many examples of harm to the residents. And what these cases do is they look at individual facilities and determine if they are meeting their minimum staffing levels that are required by our state. And if they're not, we can civilly prosecute them for low staffing and really recoup a great deal of money on behalf of the harm that they have inflicted by low staffing on their residents. Next slide. This is our state inspection authority. The Department of Justice is a bit unique in that we do have inspection authority, and I love to brag about this to our local law enforcement agencies because we have the ability to go in and inspect the business records of anyone who is a Medi-Cal provider. The idea behind this is that if you are, as a Medi-Cal provider, receiving taxpayer dollars, then the state has the right to go in and inspect your books to make sure that you are using those taxpayer dollars in a responsible, appropriate, and legal way. And that's what we do on a regular basis. This also allows us to do what's called our Operation Safe program, which is surprise inspections at skilled nursing facilities to investigate criminal complaints. And this is a really, really wonderful tool that we use. It keeps the nursing homes on their toes, and it helps us ensure that the residents are safe in their buildings. Next slide. And one more. Thank you. These are some of the referral agencies or the referring agencies that we get to DMFEA. I mentioned local law enforcement. We get cases from the local agencies as well as the Department of Social Services, the Department of Public Health, and the Department of Health, DHCS, or Healthcare Services. I always go by acronyms. as well as health professionals. We get a lot of referrals from social workers at hospitals where people will come in with clear evidence of neglect. Coroner's office, first responders, we get a lot of complaints from EMTs and paramedics who respond, for example, to a nursing home or a boarding care facility, and they then see that, ooh, this resident, this person has been neglected or abused. We get complaints from private citizens as well, and APS is on there. I know there's some APS folks out there. We love our APS and ombudsman referrals because those folks often are really what we call boots on the ground, people who are in the buildings, in homes, who are seeing evidence of abuse and neglect. Next slide. And again, this is a way that you can send a referral or a complaint to DMFEA. We receive thousands and thousands of complaints every year, and unfortunately, we are not able to investigate every one. However, we do cross-report to other agencies, our regulatory oversight agencies, such as the Department of Public Health and the Department of Social Services. So we do like getting referrals. I always give people this tip. The more information you include in your complaint referral, the better. It helps us really determine the validity of a complaint and if it could result in a viable criminal or civil action. I also tell this, people ask me often, can you submit anonymous complaints? Yes, you can. However, the flip side of that is that we don't really necessarily have a way to start the investigation. We don't have a person to contact and to get more information from if the complainant is anonymous. So we do prefer non-anonymous complaints, but you can refer a complaint anonymously. Next slide. Again, cross-reporting and reporting tips. Report early. People also ask us, well, this happened a year ago. Can I report it? Yes, you can. But your complaint has a better likelihood and a stronger likelihood of being investigated if you report it early. You can also send complaint referrals to this email at our DMFEA outreach at doj.ca.gov. That is an additional source of referral processing. Next slide. And then I think there's one more after this that you can go to because there's questions in the chat. We're always hiring. We love to hire people who are passionate about what we do. We are always looking for attorneys, special agents, investigative auditors, nurses, IT specialists, and support staff such as legal secretaries, legal analysts who are paralegals. So if you or a friend or a family member are interested in joining the Department of Justice, please look into it, and we are hiring all the time. And that's all I have. Thank you so much for listening and sharing your time with me today.
Thank you, Megan. We have a couple of questions, but we're going to hold them until after the next presentation. At this time, we'd like to welcome Eden Rosales, Acting State Long-Term Care Ombudsman for the Office of the State and Long-Term Care Ombudsman. Welcome, Eden.
Great. Thank you. Good morning, everybody. As Ranjana said, my name is Eden Rosales, and I'm the Acting State Long-Term Care Ombudsman. I want to thank you for the invitation to present to you today, and thank you for all the work that you're doing out there for a better way. Today with the presentation, I'm going to kind of guide you through a review high level of the annual report that the Ombudsman program produces, which starts off with a little bit about who the ombudsmen are, what the type of work that we do, how we're structured. And then, of course, we'll run through some data points for the federal fiscal year 23 and 24. And hopefully you'll walk away with a better understanding of who we are, what we do, and maybe how you can utilize our services or promote our program. Next slide, please. So starting off, this is our mission, and we act to seek the resolution of problems and advocate for the rights of residents of long-term care facilities. Our goal is to ensure their dignity, quality of life, and quality of care. And the Ombudsman statewide work to affect change at the local, state, and national levels to improve the quality of life and quality of care for all individuals receiving long-term care services. And as Megan had mentioned, we do consider ourselves the boots on the ground going into those facilities regularly to advocate on residents' expressed wish. We educate residents on their rights and empower them to speak up to improve their care and the care of other residents. And some of the work that we do often betters the situation for care staff as well. Next slide. In California, we are considered a decentralized program, meaning that the state office within CDA has 35 designated local programs throughout the state. And associated to those local programs in the state office, we have over 600 certified ombudsman representatives, which includes 252 paid staff and 364 approximately of certified volunteers. Next slide, please. So what do ombudsmen do? Like I mentioned, we help resolve problems for residents of nursing homes, board and cares, assisted living facilities. We also work to bring about systemic change. We also respond to reports of abuse in long-term care facilities, intermediate care facilities, other settings such as adult residential facilities and adult day programs. In California, we are tasked with witnessing advanced healthcare directives for residents in nursing homes. We also operate a 24-hour crisis line, and that number is available to anyone identifying or experiencing a crisis situation in a long-term care facility. And like I said, we do work on a local, state, and national level to bring about systemic change. Next slide, please. So our work focuses on residents' rights. And so this is what guides our work. These are our priorities. People who enter into long-term care for short or long-term stays are not due any less rights. In fact, residents' rights are outlined in both federal and state laws and regulations. Next slide, please. So jumping into some program data, we'll cover, what amount of beds we're talking about, facilities and beds, and the types of complaints that receive, some of our advocacy work, and then some of the work that we do that's kind of beyond our complaint resolution services. So next slide, please. In September, there were over 1,000 skilled nursing facilities, almost 1,200, and almost 8,000 residential care facilities for the elderly. And this totals over 300,000 beds. So in California, the Ombudsman provides regular ombudsman services to approximately 8,987 facilities that provide over 322,218 licensed beds. A long-term care ombudsman are required to provide routine, non-complaint visits to each of these facilities on a no less than every 3-month basis. Next slide, please. Next slide. So as mentioned before, we are also responsible for responding to allegations of abuse that are reported to our program on behalf of residents living within long-term care facilities and other setting types. So this is a list of our other setting types. It includes adult residential facilities, adult day programs, social rehab facilities, other specialized settings, and there are over 7,400 facilities. Next slide, please. So here you'll see the number of complaints that were received by our program in both 23 and 24 fiscal years. You can see majority of our complaints do come from the skilled nursing facility ICF settings, however, closely followed by the assisted living facilities. And then you'll see the account of other settings, the complaints received from other settings. In 2023, we received 43,820 complaints, and in 24, we saw a slight decrease to 34,864. Next slide, please. This is a breakdown of the top 5 complaints out of those 30,000+ complaints received in fiscal year 24. You'll see that physical abuse was the #1 allegation or reported to our program, followed by symptoms of unattended and gross neglect, care planning, and of course, discharge and eviction is coming in as #4 as the most commonly reported complaints in both settings. Okay, next slide, please. As mentioned again, we also cover a 24-hour crisis line, and this is a toll-free hotline that's available 24 hours a day, 7 days a week, and is to receive telephone calls and referrals to local programs for anybody experiencing or witnessing a crisis. And in 2024, we received over 21,000, almost 22,000 crisis line calls. Next slide, please. In addition to our complaint work, we also do advocacy activities. And so you'll see that we provided over 84,000 instances of information to individuals, which include residents and family members, staff, or excuse me, public, et cetera. We also conducted 69,000 plus facility visits. We attended and participated in 2,924 resident council meetings and over 200 family council meetings. We also provided 751 community education sessions. Next slide. Continuing on our activities, we provided over 34,000 instances of information exchanges to facility staff. We also provided 275 facility staff trainings and participated in over 288 facility surveys. Next slide, please. Okay. We also are charged with legislative advocacy or systems advocacy, and we participate at the local level as well as the state and federal level. And so these are kind of some legislative advocacy efforts that we contributed to in the past fiscal year, and in collaboration with the network of local ombudsman programs. And I think I will take this moment to give a shout out to Jason Sullivan and the California Long-Term Care Ombudsman Association for their robust and successful advocacy, both in legislative bills and also budgeting. So thank you. I know several of you are on this call today, so I appreciate your ongoing collaboration with the state office. And as you can see, we were successful in a handful of bills as well as the federal advocacy comments that we submitted. And you can find more information in the annual report. Next slide, please. So in addition to our work, we did receive a grant from the from the Administration for Community Living. It was an American Rescue Plan grant award, and it was to increase the capacity of our program to respond to residents and increase our accessibility. So next slide, please. The reason this is so important and a multi-year project is because, as you can see, the trend in the last several years is that we've had a marked decline in our representatives. So volunteerism has suffered, greatly. It's always been trained volunteer representatives are a critical resource for our program. And without trained volunteers, we would be unable to meet our obligations to provide that routine access to long-term care residents. And then, as you can see, we've had a dramatic decrease in the number of volunteers for many reasons. Some attributed to the mass exodus we had during the COVID pandemic, and also to the increasing complexity in managing cases that are coming into the Ombudsman program. Next slide, please. So goals of this recruitment initiative, of course, are to increase the access to residents in long-term care facilities through expanding the volunteer workforce in California. We want to modernize our approaches, rebrand ourselves, and strategize on our outreach activities, all in an effort to increase capacity and strategies for recruiting, retaining, and supporting volunteers across the state. Next slide, please. So how can you help? One way you can do it is learn more about our program and help us spread the word. You can also get involved when it's time. We'd be more than happy to have you as a certified volunteer. Certainly let your clients, residents, stakeholders know that the Ombudsman program is here and that they can contact us at any time at the state office and at the local program level. Next slide. The annual report has been released. Many of you received a copy. There should be one available to you through attending today. If not, it is posted on the Ombudsman webpage of the Department of Aging's website. This link should be active if you receive the slides. You can find out more about the Ombudsman program and the work that we've done in 23 and 24, all accessible through this annual report. So I thank you very much for your time. Next slide. And this is a great way to get in contact with me. If you have any ongoing questions or would like an annual report emailed to you, you can certainly reach out to us using the email stateomb@aging.ca.gov. So thank you again for your time this morning. I stand by for any questions.
Great. Thank you so much, Eden, for that presentation and for the critical role that the Office of the State Long-Term Ombudsman plays in protecting our older adult population. At this point, I'd like to also invite Megan back up, and we've received some questions, so I'm going to provide them in the order that they were received in the chat. Our EDJCC member, Lisa, asked, can you give us a sense of who the nursing home prosecutions are against? Are they individual workers, management, or corporations? And I believe this question was for Megan.
Sure. I think it kind of depends on whether or not we are doing a criminal prosecution or a civil prosecution under Business and Professions Code 17200, which I mentioned earlier. When we have a criminal prosecution, one of the challenges that we have in our nursing home cases is identifying the responsible staff, because so many staff members oftentimes will play a role in the care of a particular resident. That being said, what we aim to do is to focus on the management. I personally am not so keen on looking at those frontline certified nursing assistants who are underpaid and working their tails off. Sometimes they may be the responsible ones, but the ones that we do try to focus on more are the people who are responsible for the overall care. And that's on the criminal side. On our civil cases, we are looking more at the corporations and the corporate structures, as well as the administrative personnel, the administrator of a staff, perhaps the director of nursing, but really focusing on the ownership level, because the corporate folks are the ones who control the budget and they control staffing, and they are the ones who are making the conscientious decision to understaff their facility in order to make more money at the risk of the health of the residents in the facility. So those are the people who we feel are more culpable. And it's the easiest way to get to the corporate structure is through our civil litigation.
And building off of that question, we also had Vivian had a question regarding, do you have protections in place, or what mechanisms do you use to protect the identity of workers reporting their own employers?
On the criminal side, we really can't. You know, people, part of the criminal process and the process of bringing a criminal prosecution is that we have to call witnesses, and we can protect those witnesses through things like restraining orders, but they can't remain anonymous if we're going to rely upon the information they give us. So unfortunately, that is just a part of the criminal justice system. Witnesses have to be named so that they can be talked to by, or at least known to the defendant. And it's part of the defendant's rights in the criminal justice system and part of the fair discovery process that we have in the criminal justice system.
And then we also had a question from our member, Alicia, regarding the type, if you could expand, Megan, on the IHSS provider abuse type cases. Who typically can make those referrals?
Anyone can make a referral of abuse or neglect. Oftentimes what will happen is the IHSS program will sometimes, we will get fraud cases related to IHSS in terms of false billing. So for example, a beneficiary who receives IHSS services passes away and the IHSS provider continues to bill for services related to the care of this person that they're obviously not providing because the person has passed away. So sometimes we'll get fraud IHSS cases and that will grow into an abuse case, or it'll just be an abuse case because, say, a family member comes home and says, hey, mom's not being cared for, but there's someone who's supposed to be coming in from the state. What's going on here? Or the resident/beneficiary will go to the hospital and a social worker at the hospital will say, wait a minute, there's supposed to be an IHSS caretaker and this person's clearly not being taken care of. Or a family member discovers abuse. So we get referrals from family members, from state oversight agencies, from local law enforcement. It just runs the gamut. And if you see abuse, report it. That's what I tell everybody.
Thank you, Megan. And Eden, thank you for sharing about the crisis hotline. I personally was wondering, what is the volume of calls that the crisis hotline sees over a general period, or is there an average?
Yeah, I believe. Well, of course, we look at them on a weekly basis, and so there's anywhere. It depends on the week, of course, and if their holidays do pay, kind of into the fluctuation of the calls that come in. So I would say probably anywhere from about like 30, probably on average, about a week, and then of course it increases and decreases throughout the year. So I know over the weekends there's quite a few calls that come in. I think there's a little over an average of 100 that we address on Monday mornings. So,
Thank you. And then I remember Alicia also wanted to ask you, Eden, to what do you attribute the decrease in complaints from 2023 to 2024? How do these numbers compare to the pre-pandemic and mid-pandemic numbers?
yeah, great question. We have a few things. We look at those fluctuations as well. And so at the variances between the 23 and 24, what we've come to discover is that we did have a lot of program guidance clarification on how to capture the work that ombudsmen do. We provided training to those types of coding and capturing of information. You'll also see that as our complaints may have decreased, some of our other advocacy activities have increased. We've been, our number of instances of information exchange to both individuals and facility staff went up. And, we look at that as when we provide information kind of before issues rise to a level of complaint. So there's some correlation related to that. We also provided an increase in number in community education events, and that can, provide information on residents' rights and ombudsman services. And again, getting back at that, empowering the resident and their family members or their caregivers to advocate on their own behalf before it rises to a level of referral to an ombudsman program. Pre-pandemic levels, we were about, I think in 2018, I have some numbers here. In 2018, it looks like we reported about 39,346 complaints. And then, of course, during the pandemic, we dropped significantly to about 30,000 complaints, 29,265 specifically. And then shortly after the pandemic in 21, 22, and 23, we had an increase as we started to become more, I guess, back into facilities on a more frequent basis. And then we're about leveling off now. So, pre-pandemic 2018, 2019 levels, we're about the same, couple of hundred difference in complaints. So I think our bell curve is rounding out or straightening out. So I hope that answers your question.
Yes, thank you. Thank you again both for taking the time to answer the questions. I'd now like to transition it over to Carol for our break. And we do have a couple of more questions that were put in the chat box. So just to keep us on schedule and make sure that everyone has a chance to take a break, we will either come back to them later on if we have room on the agenda, if Eden and Megan are available, or we will collect them and maybe distribute the answers versus the engage inbox. Over to you, Carol.
Thank you so much. Yes, we have a break now. It is 11:18. 15 minutes puts us just after 11:30. I think that's 11:32. And we will see you back. If we can remind committee members to check their name display and turn on their camera to show that they're back from their break, that would be great. But we will see you 11:32. Thank you.
Well, welcome everyone back from break. We will now proceed with our next presentation. At this time, I'd like to welcome Ross Lillian, Chief of Research at DPRE, California, with the California Department of Aging, and Dr. Kathleen Sullivan, Director from Optimal Aging. Thank you, Ross and Dr. Sullivan, for making the time today to provide the presentation.
Thank you, Bertha. Good morning, Council. Thanks for having us this morning. I'm Ross Lillian, as Bertha mentioned. I'm the Chief of Research with CDA, and I'm joined this morning by Kathleen Sullivan, who was formerly with the Open House and was just instrumental in making this survey an actual reality from the very beginning. She's a pioneer in this space. I want to thank Kathleen for joining us this morning. So we're going to share results from one piece of the challenges to resilience study this morning. So part of the study was a survey that was administered to older adults who reside in California and are part of the LGBTQIA community. So we're going to share survey results with you this morning. There's also a follow-up focus groups. There were follow-up focus groups, to kind of fill some gaps, gain additional context, and reach the harder to reach populations. So we're happy to share the focus group results with you as well at an upcoming meeting. We'll focus on the survey today. So you can go to the next slide, please. The Williams Institute out of UCLA estimates that about 5.5% of the adults in the US identify as a member of the LGBTQ community. Other researchers have cited about 10%. So we don't have an exact number of older adults who identify as members of the LGBTQ community. However, we know it's a significant number of midlife and older Californians, but we as a state know little about their health and well-being. What we do know suggests that there's significant health disparities, but it's difficult for us to address, quantify, and develop solutions for these disparities without more data and better data, quite frankly, hence the importance of this survey. So to qualify to take this survey, one had to be at least 50 years of age, part of the community, and reside in California. The community we surveyed has been through a lot of trauma, obviously, discrimination, the hate, the violence that older members of the LGBTQ community have endured over the years can't be erased. That's part of our history, right? And this underscores why it's important to really understand the needs of this community. And that's essentially why we pursued this important data collection effort. This is the first statewide survey of midlife and older Californians who are part of the LGBTQ community. And we described this survey as a baseline because it's the first of its kind, and we hope to build upon this data collection effort. We hope this marks the beginning of a more focused, kind of consistent look at the needs of this underserved population. This is the beginning of this effort, so we don't have all the answers. This is a great starting point for us to kind of build on. It's an important, at the very minimum, I think, to start collecting and also documenting these data in an organized fashion. And we have hard data to actually reference. The survey aligns with the goals of the state's master plan for aging, all 5 goals, but in particular, goal 3 around inclusion. We received over 4,000 responses to the survey, which we're really happy about, far exceeded our initial goals. And we had responses from every census region in the state. You can go to the next slide, please. So a project of this scope, it takes a team effort, right? I'm really grateful that I was able to work with a very talented, dedicated team who made this effort into a success. The Department of Aging, we work with the Open House, the Citrus team from UC Berkeley, UCSF, and Berkeley Center for the Advanced Study of Aging Services. I also want to recognize the California Aging and Disability Research Partnership. So we at CDA work closely with the research partnership on a variety of different efforts, and they provided valuable guidance throughout the survey process. So we at CDA provided funding support for the study. I think Dr. DeMorris was a champion for the study as well. Her leadership on this effort was invaluable. She did a great job, along with our partners, on communicating the importance of the study to a variety of stakeholders and also media. And I think that really helped with our survey response numbers. We played a valuable role in also supporting our partners as appropriate, being the state lead on this study. We're fortunate to work really close with the team on each step of this process. We had an opportunity to provide feedback on survey design, the actual data analysis, reporting, et cetera. And our hope is that CDA's role kind of signals that the state government really takes these issues seriously. We're here to support all the older adults. Equity remains a cornerstone for us, and we remain committed to addressing equity gaps, and this can be a model for other states. And we're going to help colleagues throughout the state and also throughout the country who are working on similar efforts. Open House at our stakeholder efforts. So along with Kathleen, I want to recognize Marcy Adelman and Jupiter Peraza, who made up the Open House team on this effort. They developed such an impressive stakeholder advisory group. I think it included over 60 organizations. Kathleen will provide detail on the stakeholder advisory group, but they were instrumental kind of in each stage of the survey development, survey design, helping with promotion, marketing, et cetera. David Lindemann's team at Citrus UC Berkeley played a critical project management role. They also provided valuable input on survey design. They kept the trains moving, so that was really important. And David, along with Kathleen, Marcy, Dr. DeMorris, were instrumental in actually getting the survey launched. So definitely want to recognize them. They made this idea into a reality. UCSF was the lead on survey design. They actually administered the survey, and they did most of the initial data analysis. So very grateful to our partners there. And Angie Perlin from Berkeley Center for Advanced Study of Aging Services provided input during the entire survey design process. But she also led the focus group efforts, and we had an opportunity to hear from Angie on Monday during the Aging with Pride webinar about some of the focus group results. Very talented colleague who did a really thorough job with the focus groups, and we're happy to share those findings with you at a later time. Next slide, please. So I'm going to transition to Kathleen, and she's going to speak about these survey advisory groups. So take it away, Kathleen.
Thank you, Ross. It was really important, and I just want to also give another shout out to Susan DeMorris and then also Sarah Steenhausen and Ross about the willingness they had to not only do this survey, but really to allow us to ground the survey in the community. And part of that was creating an advisory committee. Jupiter Peraza from Open House did a wonderful job We recruited 12 individuals from across the state who were really leaders in their own communities and part of the LGBTQIA community. And they actually worked hand in hand with our researchers from UCSF to craft every item, every question that was on the survey. And that really was important because we wanted to ensure that there were sensitivities that were based in the community and that there was an understanding. The advisory committee also helped us with translations into both Tagalog and Spanish for the survey itself. And you, I think, go to the next slide, please. Thank you. Aside from this wonderful group of advisory committee members, we also, as Ross said, really created a statewide coalition, and we had over 60 organizations that were part of that coalition. Most were providers of care services for the LGBTQIA population, but not all of them, or not all of them had that population or this population specifically within their mission to support. So I'm talking about the wonderful C4As, for instance, around the state. The coalition helped also with giving feedback on the survey, but more importantly, there's no list of LGBTQIA people in the state of California. So we were caught with how do we actually get this survey out into the hands of people who can take it, who meet the requirements of being from the community and are age 50 or older. And that's where we relied on these 60 coalition members from across the state. They not only helped us to craft the survey itself, but they also were the ones who actually got it into the hands of Californians age 50 and older who happen to be LGBTQIA. And as you can see from what Ross said, they did a fantastic job in terms of the overall number of people that we were able to connect with. Over 4,000 took the survey itself. So I think I'm going to pass it back to Ross to go over a few other things, and then I'll be back in a moment.
Thanks, Kathleen. So we'll talk about the actual data now. Go to the next slide, please. So as I mentioned early on, with over 4,000 respondents, the survey was spent every census region in the state, and we had a good distribution of age. About one quarter were in the midlife range of 50 to 59. Over 40 respondents were 60 to 69, and about a third were 70 or older. And most of the respondents were in urban and suburban settings, over 90%, so less representation from rural communities. We kind of expected that because we met with a couple other teams who have done similar surveys, and they cited that challenge of getting more rural representation. So definitely something to keep in mind moving forward, thinking of strategies for greater rural engagement. Nonetheless, the Stakeholder Coalition and Open House did reach out to these communities, and we really attempted to get more respondents from those communities, which didn't end up being a challenge for us. Next slide, please. In terms of race ethnicity, about 3/4 of respondents were white. The largest racial ethnic group outside of the white respondents were Hispanic at about 9%, and we had similar representation from Black Californians, Asian or Pacific Islanders, and American Indian or Alaska Native, which ranged from about 4 to 6%. The majority of respondents identified as cisgender, which means that those folks identified as a gender aligning with their sex assigned at birth. We also did get responses from the gender expansive and transgender individuals, which was extremely valuable. So the survey was a major success, but we continue to strive to have a more representative sample in these types of surveys, but there's always going to be some challenges. A representative sample will take more resources, economic and human resources. That's going to be a challenge. There's still some trust issues, right? I think some folks don't trust the government to have their information. What are you going to do with my actual data? And a lot of folks have legitimate reasons to have that actual degree of distrust based on their lived experiences. And it's our job to continue to show folks what's in it for them, why it's important, how completing this type of survey could be beneficial for them. And now that we have one survey completed and have some data to share, hopefully, sorry about that. I'll slow down, Bailey. So this back up a little bit. It's our job to continue to show folks what's in it for them, why it's important, and how completing this type of survey could be beneficial for them. And now that we have one survey completed and have some data to share and hopefully some tangible action, we'll have a more compelling story to share with potential survey respondents. Next slide, please. Trying to get in some of the sorry, but could you move forward actually to the findings? Maybe there we go. Thank you so much. So we're going to get into some of the findings now. There's going to be barrier to access issues, which isn't surprising, right? There's distrust issues and biases in the delivery of medical and social services. So these findings in the slide actually jumped out at me because we see that 11% of respondents had serious thoughts of suicide in the last year, extremely high. However, what even more sobering is that our transgender and gender expansive respondents reported this at 16%. When we isolate just trans women, actually goes up to 18%. These findings are important because through lived experiences, kind of listening to our community members, kind of make these educated assumptions. I want to say that important issues such as suicidal ideation is probably higher with the LGBTQ community due to some of the challenges they face, right? But having hard data that's actually documented is critical because now we can speak to these issues with more precisely. So I think that's really critical. The same pattern exists in the survey data when looking at lifetime experiences of a traumatic event. As we get more granular with the survey data and isolate people of color, of our trans community, the data shows greater lifetime experiences of a traumatic event, higher suicidal ideation, and potentially greater need for key services. But the challenge is that these communities may have faced even more discrimination and thus have even higher distrust in service providers and others. Next slide, please. Thank you. So social support services was reported as a top need, kind of speaks to that alignment with goal 3 about inclusion. And we want older adults to be engaged in their community, obviously, volunteer roles, community leaders, etc. And isolation issues have been well documented in recent years. So that's why that finding was so important for us. Another important finding was that 17% of respondents provide caregiving type of services, but only 8% receive this type of care. So that imbalance is important to document as well and kind of aligns with the social supports being an important need. So I think with that, I'm going to hand it off to Kathleen, who's going to share the rest of the findings and some steps forward. So take it away, Kathleen.
Thank you, Ross. So if we can go to the next slide, thank you. One of the areas that we saw that presented itself across the state, oops, I apologize, that's my dog, was there were financial challenges for our respondents. So you can see 25 to 33% reported having financial concerns. And we looked at food insecurity as well. This is really a measure that people look at across the state. And we know that in our state, about 16% of people 55 to 64 years old experience food insecurity or report that they're food insecure. And you can see for this community, the numbers are almost double that figure. So we take this very seriously. There's a high degree of poverty in this community. And for those living in urban areas, they might be living in food deserts. And for those living in rural areas, they simply might not have funds to actually purchase food. So food insecurity was a high need for this community. And you can go to the next slide, please. Thank you. We also looked at reported feelings of isolation, and the state did just do a study on reported feelings of isolation across the board for all older adults in the state of California. You can see 40% of our older adults have a feeling of isolation. And we know from the wonderful work done at UCSF many years ago that feelings of isolation and not belonging have been linked to early onset of death. So this is always a warning signal for all of us gerontologists out there. But what we were interested in is the LGBTQI community also reporting high levels of isolation. And you can see for transgender older adults, 62% are reporting that they have feelings of isolation. So they're disconnected from community. And that just puts our older adults in grave danger. Feelings of isolation really mean that they're no longer connecting to community and are withdrawing from that community. Next slide, please. Thank you. We also looked, as Ross said, at what are our lifetime experiences and how they inform us in terms of receiving care, receiving services. We asked about recent experiences, and that's in the last year. And so, again, I just remind people when I'm doing this presentation, we're talking about the wonderful state of California, which is so embracing to the LGBTQIA community. And yet, in the past year, respondents said that they did have high levels of either unfair treatment, feeling discriminated against, or feeling disrespected. And not surprising to our community, however, we've never actually seen the data. We've never had data like this. Transgender women have the highest rate of reported discrimination, disrespect, or unfair treatment. So this is, again, just something that's informing us. This is baseline data, but it's very troubling for our community members. You can go to the next slide, please. We also talked about that fact that there are challenges for this community, which we are highlighting, but there's also an enormous amount of resiliency. So I always like to end with some of the resiliency that our community members report. Part of that is over quality of life. When we looked at the data and you look at who says their life is very good or excellent in terms of their quality of life, almost 60% overall say that they're satisfied with their quality of life, that it's excellent or very good. And when you look at both transgender community and then overall, and you include the option for good, we're up to almost 80%. And that's not surprising to people in the community, but it does show an enormous amount of resiliency, as does satisfaction with relationships. When you include excellent, very good, or good into the equation, most people are satisfied with the relationships. And I think that does show signs of resiliency of this community. So we saw there's a high level of isolation, but people are still satisfied with their relationships. People do an enormous amount of work to create what we call families of choice and create strong bonds with people who might not be related to them, to actually provide caregiving or just social support. You can go to the next slide, please. Out of the study, we do have a number of opportunities for action. And around the physical, cognitive, mental health challenges, as Ross was saying, we do believe that we should have really intensely tailored suicide prevention resources for LGBTQIA older adults. The fact that so many of them, 18% of transgender women, have seriously considered suicide in the past year or had suicidation thoughts, means that this is a big area that we need to pay attention to. Trauma-informed care is something that many organizations have been advocating for in California, and there are some rules or best practices for trauma-informed care, particularly in long-term care, but that really does need to be expanded. And then also just developing a network or a directory of LGBTQIA affirming service providers and collaborate with local public health officials. That's something that doesn't need to be from the state. Perhaps the state can support an effort, but local nonprofits might be able to actually do best at creating that list. You can go to the next slide, please. Thank you. And then around economic well-being, ensuring that all older adults have access to food is one way to help LGBTQIA older adults. But I do think that having some type of financial services or planning that are really tailored towards this community would be great. We know that there's high levels of poverty, particularly for lesbian couples who have the highest rate of poverty compared to all other couples. So tailoring financial services to the community could go a long way in helping folks become more economically sustainable. Next slide. Thank you. And then on social well-being, we have a number of organizations, and actually the California Department of Aging has funded organizations to create cultural competency trainings. And I think that that is something that people can take advantage of in the state. A lot of the organizations, after the department funded the creation of those trainings, offer them for free. So there's a lot of folks who can take advantage of those types of trainings. We also think that, providing ongoing support for LGBTQIA serving organizations, whether that's in a large community or in a small frontier rural community, those are the organizations that we went to get the survey into the hands of older adults because we knew they were trusted voices. So continuing to support those organizations will go a long way in helping to really build out social connections and peer support for LGBTQ older adults. And next slide, please. Thank you. And lastly is, we continue on with the training, obviously, but also just understanding that there are specific stigma-related barriers to finding or actually partaking in services. And the way to actually make your organization or community or business more welcoming to LGBTQI older adults is to actually show that you've been trained, that there are social supports within your company or in your organization. Older LGBTQIA older adults are constantly looking for whether or not they're safe based on what they hear and what they see. And one great way to show that you're a welcoming environment is to actually include them in any collateral materials that you might have for your community. And we know from our friends in Fresno, they've done a wonderful job working with first responders. So training our first responders, our mental health services, healthcare providers, will go a long way in actually expanding the support and services for this community. And I think that's our last slide, or we might have one more. Can you? Yep, that is our last slide. So thank you so much for the opportunity to present.
Thank you.
Thank you. That was very informative and impactful work to give visibility to these important issues. One of the questions that we've received so far from Vivian is, how is the state planning to integrate your survey findings into the state plan? And I'm assuming she's referring to the master plan on aging.
The master plan on aging. Well, that's a good question. We haven't spoken about that yet. The master plan for aging. We still got to think that through. Yeah, so I'm sorry, I don't have a good answer for that yet. I think we're in the phase of still presenting this information, really thinking about how to actually move it forward with some of the program policy analysis. But in terms of integrating the master plan for aging, it kind of speaks to all 5 goals. So it's important to have that hard established data because it does align with all 5 goals, especially goal 3. So we have these data now. We're kind of thinking about how to actually move it forward and actually do something with it. But at the very minimum, it's really proud to have like this really important data documented. It was lacking, right? Because we kind of speak these issues, but now we can speak to them actually more precisely and have hard data to actually back up what we're saying. So I think that's critical.
Yeah. You're so right. Well, I wait to see if there's any other individuals that would like to add questions. I was participating in an affordable housing forum, and it brought up exactly your point, Dr. Sullivan, that oftentimes that an issue for LGBTQI members to find affordable housing is whether they feel safe. And sometimes that individuals that might be married might enter that housing and decide to present as if they were not a couple until they could figure out if they're safe. So thank you for your survey that reminds us of the importance of creating those safe environments and what are obstacles that we might not readily see visible as advocates that we can look forward to improve outcomes. A follow-up question is, is there a plan to continue this survey at irregular intervals?
That's the hope, at least. There's no plan yet, but that's the hope. And this is a baseline survey, we'll call it, because it's important to collect these data ongoing. And service needs change quickly, right? We've seen that over the last few months. So it's critical to actually do that. We don't have a set plan yet as far as it is going to be CDA, like where's the funding support going to come from, but definitely it's important to continue this data collection effort. So it's on our radar. That's the hope. We don't have a set plan yet, if that makes sense.
I will just, if I may, just add that part of the challenge that Ross alluded to with having a more diverse group of people taking the survey, I think will be aided by the fact that the coalition is going to be ongoing. So Juniper Peraza at Open House is working to continue that coalition so that it's an evergreen coalition and just continuing to develop trusted relationships with Latinx community members and organizations and African American led and supporting organizations. So, I think that this is an ongoing type of conversation that we're all having. And this, again, was baseline data, and it was important just to sort of put down what is the baseline that we know. We can't generalize from it because it's convenient sampling, which means that, we go to an organization, they bring it to their members, their member might pass it to another friend of theirs. But at the same time, it was an incredible number of people that responded. So it was very strongly received.
And the focus groups are critical too, Bertha. So the one last thing for the focus
Mhm.
groups, a plug for that, that filled like really important gaps, right, to get the additional context. So I would love to come back and present with Angie Prone on some of the focus group findings. But it's really interesting. So I'd like kind of like it's the comprehensive look at this and fill some of those gaps and questions. And we have to actually speak to some of those harder to reach populations.
Yeah, that would be great. And yeah, I think that there's much that we can do to show individuals how their time and input into these surveys does make a difference in
Right.
shaping services. So thank you for that.
Yeah.
Um, so next we will transition to the next presentation on our agenda. And I'd like to welcome Regina Wright, the State Public Guardian Liaison with the California Department of Aging. Thank you, Regina, for being here with us today. I'll transition it over to you.
Thank you, Berta. I'm really excited to be here to present these findings. For those of you who are in the conservatorship subcommittee, this presentation will look familiar, but we wanted to bring it to the larger EDJCC. Next slide, please. So this presentation is going to be about the 2023 California Public Guardian Survey. So the data I'm going to be presenting today is from 2023. I conducted this survey on my own. So there is, and I got the public guardian contact information from the California State Association of Public Administrators, Public Guardians, and Public Conservators. But this study is going to be much more limited in scope because I did it on my own. So hopefully you'll find some of the findings useful. Next slide, please. So I just want to give some history of the State Public Guardian Liaison position. So this position was created as part of the California Department of Aging's 2022-2023 budget change proposal for the Master Plan for Aging implementation. And when the slides are available on the EDJCC website, this is a hyperlink that you can click on that if you wanted to read the language directly about the creation of this position. So this position serves as CDA's liaison with county public guardian programs and conducts research on probate conservatorship to formulate strategies to improve the quality of and access to probate conservatorship statewide, with the goal of protecting vulnerable individuals from abuse, neglect, exploitation, and self-neglect. One of the things I want to mention before we move to the next slide is that it was a decision by the Department of Aging to focus on probate conservatorship only. So this research and this position does not involve LPS conservatorship. That an LPS conservatorship is for folks who have a mental health disorder or a substance use disorder. So I just want to sort of set the stage to make that clear. Next slide, please. So again, this position was created as part of the Master Plan for Aging implementation. And there are two MPA goals that are related to public guardian and conservatorship. And so I'll go over those. So the first time it appeared was in the MPA 2021-2022. It was Initiative 96 to assess needs and capacities of local public guardians, public conservators, and public administrators, given growing and changing needs. So this study focused only on public guardians. It didn't focus on, again, the public conservator function, which does LPS conservatorship, or the public administrator function, which does decedent estates. Next slide, please. And then there was an MPA initiative in 2023-2024, Initiative 69, which is to explore dedicated funding opportunities for probate guardianship with caseload standards based on acuity levels. This may align with AB 1663, which reforms California's probate conservatorship system to enable people with disabilities and older adults to pursue supported decision-making as a less restrictive alternative to conservatorship. Just some commentary about some of the terminology in this slide. So probate guardianship is a term that you might hear at the national level. So for example, I believe that's the phrase that's used in Tennessee. Here in California, we don't really use the phrase probate guardianship. So this kind of is more phrased towards a national context. Here in California, we have probate conservatorship, LPS conservatorship, and limited conservatorship, which in a different state might just be called adult guardianship. And to make things even more confusing, in California, guardianship refers to guardianship of minors only. So there's a lot of diversity in how this terminology is talked about in California compared to other states. Next slide, please. So the project plan for the survey was phase 1 was to do background research. Phase 2 is the public guardian survey, which was done through SurveyMonkey. Phase 3 was optional follow-up interviews. Phase 4 was analysis of the survey and interviews. Phase 5 was to document findings, and phase 6 is the final release. Next slide, please. So as an overview, the survey and interviews focused on the probate conservatorship functions of California's public guardian programs. So the public guardian program might also administer LPS conservatorship as well, and frequently, most often, public guardian programs administer both probate conservatorship and LPS conservatorship. But when I administered the survey, I said, please only report on the probate conservatorship functions. The survey was conducted using SurveyMonkey from May through June of 2023, and optional follow-up interviews were held July through September of 2023. So 57 counties completed the survey. So we have 58 counties. We have 58 California counties. We got 57 to participate. So really high participation in the SurveyMonkey. And then 53 counties also participated in the optional follow-up interview. Next slide, please. So I kind of want to frame the survey, and the goal of the survey is really to understand county public guardians. The creation of my position as the state public guardian liaison is the state of not only the California Department of Aging, but the state of California more largely. First involvement in looking at probate conservatorship from the state level, like the first of its kind. And so really the state of California, and in particular, the Department of Aging is in like a learning mode to like understand what is going on at the county level. So the goal of this was to learn about the probate conservatorship functions of county public guardians as part of the safety net to protect vulnerable individuals from abuse, neglect, exploitation, and self-neglect. And I really do want to underscore the safety net part of this because as we know, conservatorship sometimes is portrayed like through like Britney Spears conservatorship, etc. But at its best, this really is a safety net to protect vulnerable individuals. Next slide, please. So some objectives for the survey are, to gather information about how the probate conservatorship functions in public guardian programs, like how they're structured and administered across California counties, to identify common practices and variations in how public guardians manage probate conservatorship cases. 3, to understand the challenges the public guardians face in meeting the needs of probate conservatees. And 4, to document perspectives from county stakeholders on system strengths and gaps. And 5, to build foundational knowledge to inform future efforts to strengthen the probate conservatorship safety net. So just like the LGBT presentation before me, which was like first of its kind, it's just a foundation to build upon. And so I hope that this can also be a foundation as well for future studies. Next slide, please. So I did, I looked at the public guardian organizational structure very closely. And so what this is, so there is so much variation statewide about where the public guardian program is housed. It is a county-based program. So again, public guardian is not administered at the state level. It's administered at the county level. And it's a program that the Board of Supervisors can opt to have or to not have. And fortunately, most counties have opted to have the program. So I found that about 40% of the time, the public guardian program was housed in either like a social services or a human services department. 15% of the time, it was in health and human services. And the reason I carved that out is that we're talking like the public guardian program reported directly to the director of health and human services. So it wasn't maybe a couple steps down and either divided in either to health or to human, but reported directly to the director. 15% of programs reported to the behavioral health director. So they kind of more leaned on the LPS folk. They happened to do probate, but they were also doing LPS and kind of housed under behavioral health. 10% were in health departments. And then 10 programs were in a variety of other configurations, which I have listed here. There was like 3 different standalone programs where it was either public administrator, public guardian standalone, public guardian, public conservator standalone, or public administrator, guardian, conservator standalone, and a variety of other setups. So when this slide is available, you can look at it more closely to see like all the different configurations. And there is one county in California that does not have a public guardian program. So 57 counties do have a public guardian program, but we do have one county that does not. Next slide, please. So I just want to kind of convey like what I was able to learn about some of the challenges that are sort of happening. So there's no data standardization statewide. So what this means is, so for example, like the state of California is not collecting data like on an annual basis from public guardian programs. The state of California has no authority over public guardian programs. And it's also not being collected by by the association either. So there is no data, there's no standard data elements that are collected statewide. So for example, Alameda County might have different data elements than San Francisco County. No, there's no systematic data collection, again, at the county or the state level. And, aggregating, and when I did, because I did ask for data, aggregating data from a case management system currently requires a manual workload for most public guardian programs. So for example, if I were to ask a county, how many probate conservatees do you have? It would sort of involve like pulling up in the case management system, pulling up like what would look like a spreadsheet and like sort of counting the rows, because there's no automated report to say this is how many probate conservatees we have. You would have to, so it's a very manual process because there's no built-in report right now. Next slide, please. So I wanted to understand how data is currently being tracked. So while data is not being, again, reported, to any like single entity, it is being captured in case management systems. And so for public guardian, the most common case management system is Panoramic. You can see Panoramic is by far the most common system, followed by LEAPS. One thing I want to point out is actually LEAPS is the most common case management system for adult protective services. But for public guardian, it is Panoramic. A couple other of the systems, there's one called CompuTrust that 2 counties participate in. There is another one called EMS. Some of the very, very small counties that just have a handful of conservatees, they just use a spreadsheet and some electronic files. They don't have a case management system. One thing I want to report on is that some of the smaller counties kind of felt like having a case management system would be prohibitively expensive. And so that's why they had caution about having one. Next slide, please. So again, also understanding the challenges. So the 2023-2024 MPA initiative did ask directly about funding. And so I did ask questions about, what is the probate conservatorship budget of the public guardian? So what I found was only 4 counties. So again, 57 counties have public guardian programs. Only 4 counties have a separate budget specifically for probate conservatorship. What I found was most common, it was like a mixed use budget where, let's say, the office administered public guardian, public conservator, and public administrator. They would have there would just be a single budget for all 3 of those programs. And then on top of it, that budget would really only pay for this, staff salaries and benefits. There wasn't sort of like a pot of money that could be used towards like the personal needs of the conservatees. And so while I set out to do the research by asking for a dollar amount for the budget, the response was, we don't have a budget. We don't have any money. So that's why throughout this presentation, you won't see a lot of numbers because a lot of data is again, like there's no, if you don't have a budget, like you can't really provide a number. So I really kind of want to underscore that like the public guardians are dealing with no funding. Only 4 counties really have even a separate budget for probate. So when one administers a conservatorship, when one administers a conservatorship, you can charge fees, and so the public guardian may charge fees for the conservatorship, but those fees, when charged, they're absorbed back into the county general fund and are not kept. They're not be able to kept by the public guardian. So I was just kind of informed that we're kind of over time. So I'm going to kind of move a little bit faster. Next slide, please. So I asked about the conservatorship fee schedules because I was interested, well, maybe this is a potential funding source for the public guardian if they're collecting these fees, or maybe at the minimum, it could estimate what it costs to run the program. I was wondering, okay, would the conservatorship fees be an accurate reflection of what it costs to run the program? But I found that unfortunately that's not necessarily the case, because many programs don't even charge conservatorship fees for their clients. Like if their clients are on like public benefits only and they don't have an estate, they might not charge conservatorship fees. And a lot of the schedules, this slide shows that a lot of them are very outdated. So, 9 counties, the schedule was 6 to 10 years old, 16 counties was over 10 years old, etc. So a lot of the schedules are outdated, and there was kind of, yeah, so I'll just kind of move ahead because we're kind of rushing for time, but next slide, please. So, I'll just kind of make a general point about this slide for housing placement. So the more complex somebody's case was, like if they had, a co-occurring behavioral health disorder, or they had a substance use disorder, the more complex a client's needs were, the harder it is to find placement for them. Particularly, it's very hard to find placement within the same county, especially in Northern California and north of Sacramento. A lot of, like, for example, the skilled nursing facilities are in Southern California. And that assisted living facilities were the hardest level of care to find housing due to the lack of facilities available within the county and the cost. So, for example, some of you might know that Adult Protective Services has priority on the assisted living waiver list. Public Guardian does not. So, next slide, please. These are just some kind of quotes about counties expressing concern about housing facility placement. Next slide. And so in 2020, these numbers are estimated from 2023. There's an estimated 3,642 active probate conservatorship cases in California with county public guardians offices. And there are 2,863 referrals for probate conservatorship made to county public guardians every calendar year. And again, this was a very manual process for the public guardians to have to manually calculate these numbers to provide them to me. Next slide, please. With this slide, I just want to kind of emphasize that there is a really important relationship between a public guardian and Adult Protective Services. When I asked public guardian where their number one referral source was from, statewide, it was from Adult Protective Services. That could vary by county, but looking at all counties combined, most referrals come from Adult Protective Services. Next slide, please. Okay, so sorry, I kind of rushed through that because we were kind of not a lot of time, but if you have questions, I think we could probably, compile them and provide answers for you. Thank you.
I think we have time to do one question before we move on. So one of the questions that has come up is, what is the state doing to increase equity across public guardian offices?
Could we have some more context about about equity across public guardian offices?
I asked the question, Regina. I'm just asking because in your presentation, you
Hmm.
outlined the vast differences that
Hmm.
exist amongst the different
Yeah.
public guardian offices. So really just asking what at the state are you looking at in terms of bringing like parity between the different guardian offices so that people aren't receiving, different
Hmm.
levels of service depending on what county they live in.
Yeah, thank you. So, the Department of Aging is in a unique position because, again, we have no authority or oversight for the public guardian program, so we certainly can't tell them what to do. But, I actually want to highlight some of Renita Polk's work where, the County Welfare Directors Association had a template memorandum between Adult Protective Services and public guardian programs. And Renita very recently worked to update that memorandum in order to sort of standardize the communication between APS and public guardian. And so that's definitely one effort to sort of like standardize statewide. There is also one of the things I found as well, there is no, to kind of speak to your question about equity, there isn't a standard referral form like there is, for example, for adult protective services for public guardian. And so that's an opportunity. That's a very clear opportunity to have equity statewide is to standardize the referral form. And I think APS would be a perfect model for that.
Thank you, Regina. Thank you for your presentation. Appreciate it. We'll now transition to Achilles Saran. Over to you, Achilles.
Hi, I'm Achilles Soron. I'm the APS Program Director with San Francisco Human Services Agency. And I am the chair of the currently Adult Abuse Response Committee chair. Next slide, please. And actually go to the next slide as well. Since the beginning of the Elder and Disability Justice Coordinating Council, us being one of the three subcommittees, we had the Adult Protective Services name. And since 2019, when we started this work, we realized that the actual fabric that receives and responds to reports of suspected abuse in California is more than Adult Protective Services. So in order to increase our partnership, collaboration, focus, and mission, we decided to change the name to Adult Abuse Response Committee so that our attendees can have a more global focus on how do we work together. As you saw in some of the presentations earlier, we have a number of skilled nursing facilities, residential care facilities for the elderly, and in addition to those, we have long-term care facilities, and we're talking about, probably, 17,000 of these. And many of these do not fall under Adult Protective Services jurisdiction, yet local law enforcement and the ombudsman play a big role in receiving and responding to these. And then you have licensing and you have the Division of Medical Fraud and Elder Abuse. So with that in mind, we decided to change the name. Next slide. That's going to be my last slide. We decided to change the name so that we can, as we're thinking through the gaps and proposing and elevating what we think would be most helpful in California to receive and respond to these reports, regardless of setting, to have a name that represents a broader mission and more partnership and collaboration. And I will leave it at that. Thank you, Bertha.
Thank you, Achilles. I'll now transition to Vivian, and Vivian will share out and explain our next portion of our agenda. Vivian?
Thanks, Berta. So now we are to kind of a new portion of our meetings. As Berta mentioned at the beginning of the meeting, we will have this portion right now to have a discussion of pressing issues. So please note that the pressing issues that you will bring up right now will be placed into a recommendations memo that will be shared with the Cal HHS secretary. And so this is just an opportunity for all of the members of the council to elevate any key concerns that they have and really encourage, a discussion. So we really also want to focus on if you have any cross-system gaps, funding needs, local innovations that you want to highlight. So all of these will be put into a document that will be going to HSS. There's no guarantee that action will be taken on any of these issues, but they will be submitted to HSS Secretary, and these issues are going to be memorialized in a document. So if we could actually, maybe make the screen so that everyone can see all the council members, if anyone would like to start. I guess if you could see all the panelists.
I'd like to start by just reflecting on our agenda so far and just recognizing the importance of the value and the investment that's been made in the studies, like with the Public Guardian study and the study that Ross and Dr. Sullivan presented on. All of those studies and those investments that were taken by CDA will now trickle down to helping us as advocates on the ground strengthen services, provide more informed services, and use that data to also garner support for services. So I just want to elevate the importance of continuing to make those type of investments.
Thanks, Berta, and any other panelists, feel free to unmute. While we're waiting, I will also highlight that it was placed in the chat that CDA is accepting comments on their state plan, I believe until June 21st. So a really great opportunity to highlight to the state things that you think are important that we've discussed today on today's meeting. Someone has their hand up. I can't see it, but go ahead and unmute.
I guess that's me. Yeah, I'm not sure that this is the time for it, but I guess I'm just thinking with all of the confusion and fear that we're seeing around the state about immigration issues that is affecting many seniors and many caregivers. I'm wondering if maybe we can hear from some of the agencies, Adult Protective Services, the legal services community, of what they're seeing, or have they seen a increase in referrals or a decrease in referrals based on people being fearful of coming? Are we getting, the legal services doing anything differently about people being dropped from benefits, of knowing their rights as immigrants? I guess that's kind of a question for everybody.
I can speak to that on the legal services side. We're starting to see an increase in from different organizations wanting resources on exactly what are protocols if certain agencies would visit, like nursing homes, and Justice and Aging has a great resource on that. I'll try to locate it and put it in the chat. We're also just identifying the increased need to help families with emergency planning. And should there be a need in changes in caregiving situations and housing situations, helping individuals create caregiver succession plans. And that term really is from our partners at Department of Developmental Services that recently also updated their individual personalized plans. That is a document that the individual who receives, and Allison, I know you're on, so feel free if you want to jump in and speak to it, but also provides an opportunity for people to kind of outline and engage with, should there be transitions in caregiving, who would step up and be next. So we're starting, from the legal services side, we are just starting more to first hear from our community partners and I think and support groups where individuals feel safe and going to. And then right now just mobilizing to create informational resources for individuals.
Is that just being done like individual counties, or is there any kind of directive from the state legal services network?
Well, I'll just say how I can just speak to how I'm approaching it. Actually, I've leaned on the members that I've learned and partnerships that I've met through EDJCC to reach out to some of our community partner organizations that provide services in the cross population to kind of find out what they're doing to make sure that we're in concert and how we're putting out materials. I think one of the strongest things that we can always do is make sure that we're using the same language when we're referring to a type of service or when we're communicating information. So we're working in partnership with those agencies, and then again looking to the statewide agencies like Justice and Aging and Canner that are putting out resources. I think the pace and the level of which activity might be going on is at a level that was not seen before, and so I think it is creating materials as we are trying to make them responsive of what people are seeing or experiencing on the ground.
If I may, this is Allison from DDS. I know DDS has put a message out to the community, which you can find if you go straight to our website, and if you just look under highlights, there's a message to the community. And then if you go under regional center directives, you can see a message directed to regional centers around information sharing. So individuals served and information sharing around that. Those are great reads. And then there's some links and additional resources in those. So that's some direct information from the Department of Developmental Services. And if it's acceptable and people are okay, I'm happy to put those links to the DDS website in the chat.
I'd also add, legal services attorneys and legal services organizations are still bound by the ethical rules of the California Bar. So, sharing information regarding a client or any kind of client information that is still governed by our ethical duties as attorneys, and nothing's changed on that front. Client confidentiality is still, one of the most important tenets of the lawyer-client relationship.
And then being in Los Angeles, I'll also just elevate another moment of appreciation for our member, Lisa Coleman, that the California Commission on Aging did have hearings on post-disaster of the wildfires. And I think from the hearings, and I believe you can visit their site for information, that they might be making the recording available on their site. But it's been, again, emergency planning, the importance of continuing to create resilience in our communities. And I think one issue that has emerged is the vulnerability that older adults face when seeking reverse mortgages as they're recovering from natural disasters, not perhaps being as well informed of the implications should a natural disaster occur, of what would be their process, and also just in general the potential for perhaps increased education and or counseling when somebody is going to secure a reverse mortgage so that they can better weigh the options and the risks.
Before we close out, I also wanted to highlight the CDA LGBTQIA older adult survey. I think that, the stats that were shared about older adult isolation were really shocking and quite disturbing, honestly. And I think that just that based on that data alone, there are some really great opportunities for the state to lead on mitigating this isolation and the dangers associated with this isolation, knowing that there's a specific group of individuals who are significantly more at risk. And if we don't have any more comments, I will pass it on so that we can move to public comment.
Hello, thank you. This is our public comment period for the EDJCC meeting today. So if you have a comment, happy to hear from you now. If you are on the phone, you may press *9. That will indicate to us you have a comment. Or via your Zoom toolbar, you have a raised hand icon. And so you can hit that. And we're happy to take your comment. Do know that we will, public commenters have 2 minutes, just so we can make sure we get to all. And at any time, please feel free to send your written comments to engage, ENGAGE at aging.ca.gov, and we'd be happy to take your written comments there. So happy to take any comments at this time. Again, at any time, you can send your written comments to our Engage email box. It's monitored all through the business week. Engage, ENGAGE at aging, AGING.ca.gov. And I'm happy to turn this back to you, Bertha, if you would like to proceed.
Thank you. Thank you, Carol.
Sure.
Well, at this time, I would also like to welcome Director Susan DeMorris as we proceed towards the closing of our meeting. Director DeMorris.
Thank you, Berta. Thank you, everyone. What an informative meeting. And, going back to the opening where we looked, we all recommitted to the guiding principles. I think today's agenda just really adhered to the guiding principles. I saw all of them come to life with the presentations and the topics that we discussed. And, in particular, I'm really hearing, not surprisingly, the intersectionality of the work that's happening across the state in cities, communities, counties, regions, with all of you. So lots of overlap in the best possible way as we focus on the populations at greatest risk of abuse, neglect, and exploitation, and those who have been victimized. So I just really applaud our state partners and stakeholder leaders for developing today's agenda. It was a lightning round of good things happening around our state and progress being made. And all of us joining today know that we still have a long, long way to go. So I'm very proud of the achievements that all of you highlighted today, the work that's being done. It's inspiring, and it also, the numbers and the volume for all of you who reported statistics, it's just staggering to think of the number of people in a state our size that need these resources, that need the information, assistance, advocacy, intervention, and recovery. So thank you all for your contributions today. Thank you for developing an outstanding agenda. Thank you for your comments and the resources in the chat. Lots of resources, as always, shared with our group. Thank you. Thank you so much. Looking at our master plan for aging, apart from the guiding principles of this coordinating council, we have 3 fallback things we always say. It is a public-private partnership. So we saw evidence of that today. Thank you, AARP, a great private partner. We talk about it being a whole of government approach. And absolutely, we saw San Diego County represented. We saw many state partners and state departments and agencies represented. And then we say it as a report that won't sit on the shelf. And so thank you, Regina. You reminded us of the initiatives that have already been acted on and closed out, initiatives that are in progress. And as you all know, conversations today will shape and influence future initiatives. So this is a wonderful, wonderful demonstration of the Master Plan for Aging at work. And one of the best examples we have of stakeholder-led work, community-driven work. So thank you all. And Lisa, thank you for your final question that prompted additional resources in the chat. Again, another area of intersectionality for the hundreds of thousands, if millions of Californians who are immigrants and are fearful today to share out the resources that are available through the state and through our private partners like Betzedek and others. So thank you all very much for your contributions today, your continued work on elder and disability justice, and we look forward to our next meeting. Carol, do I turn it back to you?
I am on mute. Bertha, did you want to say anything?
I'll just close it out by just saying a few housekeeping matters. Please make sure to save the date for our next meeting, Thursday, October 16th, around the same time for 10 to 1 p.m. Please share the materials that were created today and that are posted on the Cal HCC EDJC website with your other community partners. There's so much rich and actionable resources for all partners, and we really want to get that out as much as possible to other community partners. For those who are appointed members, keep an eye out for the Engage email from the chairs regarding upcoming meeting structures. And again, we thank you for prioritizing and making this meeting a priority. Over to you, Carol.
I think that concludes our meeting. Thank you all for coming. We appreciate your time. Stay connected with mpa.aging.ca.gov or contact us anytime at engage, E-N-G-A-G-E, at aging.ca.gov. And of course, we've got various social media tags that you can contact us with. So take care. Thank you. Thank you, Bertha, for your great facilitation. Take care, everyone.